You must get your hands dirty. That means go out into the field, because you can't become a good public health practitioner if you haven't been to the field. So you must go, you must work in the village, in the block, in the district level, and then you think of coming to the state or national level. Being from a medical background, I wanted to go into public health because I realized that being in clinical practice, you can only do so much. Unless you go into public health and you look at a larger picture of whatever the health programs are, that is where I looked at my future. And then since LSHTM had a course for public health in developing countries, and being from a developing country myself and wanting to come back and serve here, that seemed the perfect fit. And also, besides that, I think when I went through the whole modules, the options of the various courses which were there, I think the whole selection was immense. So that had many options of building up my expertise. So that's, I thought, is really good option, and that's why I really selected LSHTM. A few lessons I would say. First is that there is no age to study. We had ages ranging from say 24 to almost 50. And that was, I think, the beauty of getting all the ages together, listening to all of them, and then discussing. So the way we discussed, that I think made me a different person, especially because I ended up listening more to my own juniors, when I came back and started serving. That is, I think, made me a better person and a better administrator here as well, because I have a team of consultants who I work with. Interacting with people from across the world was such a rich experience. With one of my colleagues was from Peru, one was, of course, UK, then we had a German class. I mean, just a few countries, and I'm still in touch with them, at least on email. So that is, you build lifelong relationships also when you meet from people from across so many countries with varying backgrounds. So I have come with the experience of having clinical work in the district and the state headquarters, and then going into public health at the state headquarters, working 2-3 years, learning the ropes there, and then moving to the national government here at the ministry level. So all that is a learning, like, because what you learn in the state is what you implement when you come back to the national level, but the entire background is the public health background. So all those learnings are kind of reiterated, and it's easy for me to even implement the programs here because I think the background of public health is very strong. After COVID-19, India as a country has realized that clinical specialists are a really important breed. So you do need to nurture those doctors out there, right? So that is very important. On the other hand, public health also has become really important because I think as a country we have realized that to implement any intervention, whether it is for COVID or non-COVID, you need to have some public health system in place. And to run the public health system, you need to have people who are aware of what public health means. So to manage an entire community, your, I think, mindset, perspective has to be different from looking after one patient or two patients or maybe 50 patients. So that mindset happens only after you get trained, and that, I think, for a country like India, it becomes really important to train a large set of people in public health. So I would say, have some plan in mind, think of the subject you want to maybe specialize or work in when you come back, and open questions, discussions are absolutely great.